ambulance. What's the town or suburb of your emergency?
I'm on the Logan motorway between Paradise Road and Beaudesert Road.
Okay, and what's your name?
Mandy.
Okay, Mandy, tell me exactly what's happened.
There's been a motorbike accident just in front of a truck behind, like next to me kind of thing. We've got two people.
Okay, so a truck versus a motorbike?
No, just the bike. The wheels come off the bike. Yeah, just the bike. And it's off a sidecar and it's gone into the railing and we've got two people on the ground, yeah.
Okay, all right.
Two elderly people.
Yeah, okay.
Not moving them at all.
Yeah, all right. Let's get some help out there for them. So you're with them right now?
Yeah, I'm with them right now.
And there's two patients there.
Keep talking to me, buddy, yeah? Okay, you stay here, all right?
Okay.
Yeah. One's name's Russell, and what's your partner's name? Helen. We've got Russell
and Helen. Okay.
Yes,
and so I'm just making
Helen.
sure I understand exactly what's happened. The wheels have come off the sidecar and they've gone into the railing of a motorbike?
The railing.
Yeah,
off the
okay.
sidecar. Yeah.
Off a sidecar, okay. Is anyone trapped?
No one's trapped. No.
Okay. Was anyone thrown from the vehicle?
Yeah, both.
Both of them were thrown. Okay.
Yeah.
All right. Okay. Does everyone appear to be completely awake?
No. Russell's really struggling to breathe. Holy shit.
Every day, Queensland Ambulance receives more than 2,800 calls for help.
Got a 94-year-old lady thrust in her electric chair.
Three men had my neighbours surrounded. One of them throughout the failing and swinging it at everyone.
Just ran over.
Who's him?
The baby.
With unprecedented access,
Motorcycle with sidecar, the wheels come off.
we follow emergencies
Hello, the paramedic.
from the heart of the operations centre
Is she breathing?
No!
We've got help coming to you, okay?
to the paramedics on the front line,
You got a haircut like me?
fighting to save lives.
All she wants is just a little bit of human touch.
Oh my God, I'm shaking so bad.
You're doing a really, really good job in a very stressful situation.
Her ribs and her hips she's complaining of. Okay. Hey. I know you're uncomfortable. I don't say nothing I want you to move right now, okay? Yeah? They won't be long.
You're doing a really good job there, Mandy.
Oh my God, I can't believe this has just happened.
All right, I'm organising that help for them now. Just stay on the line and I'll tell you exactly what to do next.
I just need some keys. The wheel has come off a motorbike sidecar. Two patients lying on the road. Seems like limb injuries. Looks like we have multiple resources going to it.
3 ambulances, a critical care paramedic and Haru, the high acuity response unit, are dispatched to the crash. Queensland Police and fire services are also mobilised. The closest ambulance is 5 minutes away.
So the tyres come off. One person's having trouble breathing
Yeah, wheels come off the motorcycle.
and hit someone.
No, the motorcycle. Then it's a motorcycle with a sidecar. So
and
two
then they hit
people,
the side.
and then they hit the guardrail.
The
apparently.
sidecar hit the side rail.
The high acuity response unit goes to both trauma and medical. So we go to the sickest people around in our area that call for an ambulance every day.
I would not like to be in the sidecar.
No. Low to the ground.
When we think about going to high-speed motorcycle accidents, we're always suspicious that the patient is going to have severe injuries. And in the older age group of patients, we suspect that there may well be underlying conditions that will contribute to how the patient responds to this injury, such as brittle bones as the patient gets older, such as medications that might alter the way the patient responds to injury, and also medications that the patient may be on to thin their blood, which makes them bleed more and potentially become critically unwell more quickly than other patients may do.
She doesn't have a good sign.
No, it's not.
On Haru, we often arrive not as the first crew. And usually the first crews have actually got the more difficult job because they've got to get control of a chaotic scene. They've got to do the initial assessment and identify that this patient is critically unwell.
Apparently the wheels come off, it's done a bit of a spin, it's gone into the guardrail, and they were ejected from where it stopped to where they've landed.
Yeah. John can have a look at him.
Yeah.
Have a look at them.
Dr. John assesses the male driver while Andrew attends to the female passenger. Both were ejected onto the road at speed.
It's really important that you don't stop momentum when you arrive on scene. Paramedics are clearly doing a very good job in assessing this patient, so it's very important that we don't interrupt that work, but also important that we do an assessment to make sure that there's nothing that has been missed.
Was that left chest sore when I pressed on it? So if I press in the front, does it hurt does it hurt where I'm pressing or hurt at the side? Where I'm pressing, I'm sorry. I'm gonna have a look at his back once we get him on his side. Okay, so no marks, no abrasions, anything else? It's all good.
Not so much we can tell at the moment. We're going to do an ultrasound scan once we get him extricated as well, just to do a bit of an extra check.
It's always good when the patient is awake and talking to you, but it doesn't necessarily mean that they won't deteriorate quickly or at a later stage. So the mechanism always keeps me concerned.
In addition to his broken limbs, the male patient is at risk of internal injury.
I'm just going to have a quick look at your tummy with the ultrasound scanner. So it's a little bit cold, but it shouldn't hurt at all, okay?
Yeah, with the
Sorry, yeah. You've had ultrasounds before?
I was a nurse in the hospital.
Oh, I see. You can do your own ultrasound.
Ultrasound can be a really useful tool in the pre-hospital environment. We generally use it to identify intra-abdominal bleeding, which in turn allows us to pre-notify the hospital to get them ready to receive a critical patient.
That all looks good, but you may well have broken a rib or two there, Russell.
Dr. John's assessment of the motorcycle driver rules out internal bleeding. However, the sidecar passenger has sustained more significant injuries.
Alan, what's your fingers, darling? Are you sore?
Yeah.
Your chest is sore? Well, just have a look at that hip. This is the worst hip, eh?
She appears to have fractured either her hip or pelvis and is complaining of severe chest pain, which could indicate a collapsed lung.
Hey, Helen, are you sore where I'm pressing?
Hi.
Are you sore here in your chest?
Yeah.
Are you sure? Where I'm pressing?
Yeah.
So when we arrive on scene and we assess the patient, the degree of severity is very hard to work out. People can walk away from nasty crashes or relatively minor, what we think is minor things can cause someone to die.
We just need to pull her hips through a little bit. I'll scan her in the car. Let's head to the car, guys.
All done, Helen. We're finished. Open now. Finished. Nice deep breath.
All right, Harry, you just watch ahead. We'll pop her in. I'll scan her in the car. If you're happy to pop her in, I'll bring some gear in.
On the Logan Highway in Ipswich, Dr. John and critical care paramedic Andrew are treating a woman with a suspected collapsed lung.
You got a history of high blood pressure and you take aspirin. Is that the only thing?
No, aspirin.
What do you take the Ramapril for?
My heart.
Okay.
Part of our assessment is a FAST scan, which stands for Focused Assessment with Sonography in Trauma. So that enables a snapshot picture whether someone's bleeding in their abdomen and maybe in their chest.
All right, just gonna have a listen to your breathing.
Because you can bleed and not be evident in your vital signs or your outward appearance. So we're just trying to find if there's signs of occult bleeding.
John, you happy with the other guy?
Yes, they have a negative fact, yeah.
I think this is negative. So it's at 83.
The ultrasound shows no internal bleeding. However, the biggest cause for concern is that her oxygen stats are falling.
So, mate, do you want to have a quick another look at her, listen to her chest before we leave? She's probably got a pneumothorax. I don't think she needs any ketamine.
So stats are good with oxygen.
So that's
only what?
Just 6 litres.
6 litres, yeah, okay.
So you code 1?
Yeah, we'll go code 1.
Yeah.
Thank you.
The sidecar passenger appears to have air leaking from her lungs into her chest cavity. This is also known as a collapsed lung or pneumothorax.
I'm just going to have a little look at your chest, Helen. We'll figure out why your oxygen levels are a touch low, okay?
Oh.
Sorry, is that sore where I press, Helen?
Yeah.
Yeah, I'm sorry.
That's all right. Oh.
Helen, how old are you?
75.
You're just getting into your prime, hey?
Oh, fair dinkum.
If we suspect that the patient has a pneumothorax or a collapsed lung, there's significant potential that the patient could deteriorate quickly. If the pneumothorax becomes bigger and starts to compromise the patient, we may need to decompress their chest, either with a needle or by making a surgical incision in the chest wall. So we need to monitor them very closely.
How far? How long?
We're about 20 minutes, Helen.
Okay.
How's your pain going, Helen?
It's all right while I'm still.
Sure, alrighty.
Fine.
We've got lots of painkillers and we're not afraid to use them, so you let us know how we are.
Yeah.
Sorry, no, I'm gonna try to make this up a bit. Yeah, I bet they do. Could we do a bit more fentanyl, please? Just the bumps are hurting.
Queensland roads are wonderful, aren't they?
Queensland roads?
Yeah, they are.
You must feel all the bumps in a sidecar, surely.
Not too bad.
Huh. I bet you felt that last bump.
Oh, God, yeah.
You're pretty brave to go in a sidecar.
I couldn't believe it. I won't be back in the sidecar again.
Yeah, I wouldn't blame you.
That's it.
I'm not brave enough for that.
I try to keep it lighthearted. I grew up in a pub in rural Ireland, and I did a lot of talking to people through my formative years, and I used some of those skills to try and reassure people, talking to people, finding out their story, helping them along their way.
So, Helen, what's in the sidecar? What kind of seat is in there?
Plenty of room, plenty of room.
Do you remember the crash? Did you slow down a fair bit before you came out?
Tried to tell him, but no.
Oh, you noticed it was coming loose, did you?
Yeah.
Yeah, okay.
I tried to tell him, but he can't hear me.
Yeah.
Oh, of course. Well,
you'll have to get intercoms for the next time.
Oh, it won't be any next time.
Wiggle your toes again for us.
Hey?
Wiggle your toes. And that one?
I think there's always a benefit to having two people. And I think that's one of the benefits of the doctor and paramedic model. Patients benefit from the combination of care that we can give.
You've done well, Helen. Very traumatic event for you. Thanks.
And we have a lot of fun working together. And I think we're a pretty good team. I love it. It's the best job I've ever had.
Just moving your head.
That's it, Helen. Well done.
Ambulance, what's the town or suburb of your emergency?
It's midday and the operations centres are fielding an unusually high volume of calls, with around one call every 25 seconds.
Okay, is he breathing?
All right, Chris, I'm organising help for them now. Stay on the line and I'll tell you exactly what to do next.
Very busy, but it's okay. Just take each call as it comes.
So we are extremely busy at the moment, so it could be just delayed for a while.
It's just ridiculous. Just the workload at the moment.
171, I'll get you heading towards Burma Street Station, please.
To stay on top of demand, dispatchers are sharing ambulances across the network.
Can I use 266 for code 1?
113?
Where are they going? What are they doing?
They're like Greenslopes-ish. They're fanging it down the motorway, but...
That's right, they can fang it back up the motorway. I mean, I know there's Met South and Met North, but realistically, when we're this busy, it doesn't really matter. It's where the demand is. So, yeah. But it's nice. It's really good when there's a lot of communication within the communication centre.
Hi, this is the ambulance. Tell me exactly what's happened.
My friend, she was trying to pick up my cat that was on the other building, on the other apartment.
Yes?
And she fell from the third floor to the ground. She kicked very hard, and her arm is like, I think broken. She's just crying, and she has a lot of bruise on the left side of the body.
Sure. I'll get her some help.
506 414. Have you proceeding code 1, thanks.
You'll be heading to a 33-year-old female, has a fall from the 3rd floor.
It's a long way to fall. That's three stories, is that what you said?
From 3rd story. Yeah.
The call is prioritised code 1. Multiple units are dispatched. 4 ambulances, Queensland Police and Haru. Critical care paramedic Andrew and Dr. John are 10 minutes away.
But I guess with a mechanism like that, you've always got to consider the worst case scenario. A fall of over 30 feet is a lot of energy that's going to be sustained by the body.
This could be a very significant mechanism of injury. A fall from 3 stories means this patient will have fallen quite a distance and will have gained quite a bit of speed before they come to a sudden stop on the ground.
But I would still be concerned about intra-abdominal injuries, abdominal bleeding, chest injuries.
The patient may have any combination of head, neck, chest, abdominal, pelvic, or limb injuries and is potentially going to be critically unwell.
It's often very hard to know exactly what you're going to see until you get there. So that's that famous line, hope for the best but expect the worst.
Thank you. Well, we're going to a 30-year-old, is she?
33.
33-year-old who's fallen 3 stories. I try and have a pretty open mind going to cases. I try not to think too far ahead because I end up being pigeonholed and railroaded into a way of thinking. No primary crew.
We've had a chat to the consult line.
It's not up here.
Arriving at the scene, the crews find that the patient is no longer outside.
Oh, how's it going? It's all very strange. Knock, knock. Hello. Katarina, my name's Andrew. This is Julie and John. What's happened? Where did you fall? Katarina?
Yeah.
Where did you fall?
I need my flatmate. Yes.
Where did she fall?
She fell from the outside area.
From that balcony to the ground.
It's all about 3 metres.
So this is the first floor, though, she fell. And then she fell down. Okay. Where's your worst pain, Katarina?
Yeah.
Okay. Anywhere else? And your arm, just down here? When we get to scenes and patients have done some strange things post the incident, I think it can be put down to the initial shock of the trauma. It's important to have an open mind because people can do strange things and still be really badly injured. How did you get back inside? You walked?
Yeah.
Okay, I'm going to pop this on your finger. Well done.
Is that sore at all where I'm pressing? Sore in here?
Yes.
Sore there?
Yeah.
Okay. What about here? There? On your hip? Yep. Sore on this hip? Okay. Okay.
And do a quick scan and see.
Yeah. So, I mean, I think it's isolated. This,
yeah.
I think it's unlikely she's done a pelvis if she walked in here.
Yeah.
All right, so I'll get a line in. We're going to splint this arm, darling. Is that the worst pain?
Yeah.
Where are you from? Colombia. So is John.
I'm from Ireland.
With orthopaedic injuries and people in pain, if we can bring some calm with analgesia and our rubbish jokes sometimes, that enables them to relax, and then they can tell us if they have more pain elsewhere to rule out things that might be life-threatening.
How long have you been in Australia for?
1 year. 3 years.
How long are you going to stay for? Forever? You don't want to go home?
Okay, so fast negative, Andrew.
The ultrasound indicates the patient has no internal injuries.
It's definitely a pleasant surprise when we go to jobs that sound bad and aren't as bad.
Got a good story. She's chasing a cat.
Those cats.
And she's there falling down, but she wasn't knocked out at any time. She's got herself up and walked back.
Good for the patient. It's good for our stress levels. It's generally it's going to be a good outcome for everyone.
Katarina, I'm just going to give you a bit of pain relief in your arm, okay? Let us know if you feel like you're going to vomit, because we can give you something for that, okay?
We can deal with the injuries quite well. We can get them to hospital and take away a lot of their pain.
Katarina, we're going to put a little bandage splint on your arm.
You know that what you do will reduce their pain and suffering.
Okay, Katarina, just going to move the arm very slightly now. Well done.
1, 2, 3. Oh, no! That's
Your hip.
Is the hair under my hand?
We will go to a few of the high emotional jobs in a day, but we need to remember that for that patient and family, it's probably calling an ambulance is sometimes a once-in-a-lifetime event, which is a good thing. You okay? We need to be mindful of their emotional state and realise that this could be the worst thing that's happened to them for a long time. Just keep your head nice and still for us. And just try and take away some of that anxiety for them. Mate, so you know the drug dosages too?
100 mic.
Had 100 mics, yeah. Yeah. Thank you. Thanks for that. All the best. I like going on those jobs. Actually take a bit of pain relief. Isolated orthopaedic injuries are always good.
Yeah, you can actually do something about them.
They're not going to die.
Yeah. And you can make them feel better.
Yeah.
Just get a dog.
Yeah, you don't have to chase dogs over the balcony. Yeah. Never been to a job where someone's chased a dog over the balcony and fallen off.
I've been to a job where somebody got chased by a dog over a balcony.
Yeah, well, that's different. Yeah. But they probably did something to the dog.
They probably did.
Dogs are inherently good. See, that cat is now, like, eating its kibble. Going, see? The plan paid off.
Yeah, it's delighted with itself.
The cat's thinking, one down, one to go.
Ambulance, what is the town or suburb of the emergency? It's outside. My daughter Megan, she's having a seizure.
Okay, we'll get her some help, okay? How old is she?
32. She has a disability.
Is she diabetic?
Yes, she is.
Okay. Is she an epileptic?
Yes, sorry, yes.
Has the twitching stopped yet?
No. It's not even a grand mal. I don't know what this is. Tonic nothing to go through. She is. She's very cyanotic.
Okay, so I'm organising help for you.
Leanne,
you need to listen to me. I'm organising help for you. Stay on the line. I'll tell you exactly what to do next.
The nearest ambulance is 8 minutes away.
She's got a sleep apnea machine on. Should I take it off, leave it on? What should I do?
Okay.
It's not registering any oxygen at all. Nothing's registering. I don't know how long she's been like this. It's already been 7 minutes now. Oh, no.
She's not breathing now.
Megan, no. Okay, all right, we've got to register. 87 oxygen, 65 heart rate. Thank goodness. Oh.
Has she stopped fitting?
I don't know.
Is she still shaking? Is she twitching?
No, she's not. This is a total static seizure. You know, where everything just stiffens.
Okay, so tell me immediately when she stops. Is she currently breathing?
Honey, Megan. No, it's not registering at all.
Is she breathing?
Megan. Oh, no, not really. Sort of. No, she's not. No, she's not. She's going cyanotic. Oh, my God. How far away is this ambulance?
Is she breathing?
No. Sorry, I don't mean to yell.
That's okay.
Come on, Meg.
We've got help coming to you, okay?
Oh, gosh. Oh, Maggie, breathe. Maggie, breathe. Breathe, Meg. Megan.
At the Brisbane Operations Centre, Bree is on call with a woman whose daughter is having a seizure.
Okay, so are you able to get her on the floor?
Okay, just hang on a second. Oh, my God.
Is she breathing now?
Yes, she is.
Okay.
I'm so sorry for my panic. I don't normally panic. This just freaked me out. I'm sorry.
That's okay. That's what we're here for. I understand it's probably pretty scary there for you, so we've got an ambulance coming to you, lights and sirens. They're only a couple of minutes away. So has she woken up? Has the seizure stopped? So just turn her gently on her side, okay?
She's on the side.
She's now on her side, okay. Just tell me when the paramedics are right there with her. They're just coming up the road now, so they shouldn't be too far.
Okay, cool.
Is that them?
Sorry.
Is that them there now?
Yeah.
All right,
We'll take it.
I'll leave you with them. Thanks.
Thank you so much.
You're right. Thank you. Bye. Thought I was going to lose her for a second there. Seizures are usually highly emotive anyway, but that was probably one of the worst seizures I've ever had. And I thought she'd gone into arrest. I actually thought she wasn't actually having a seizure at one point. So I was ready to do CPR. Luckily I didn't, but yeah, that was a pretty bad seizure. And I have epilepsy myself, so it kind of hits home a bit too.
Sounds like it's been a busy day today.
You just take it as it comes and manage it the best you can and soldier on
See
with
what
it.
you can do, that's it.
Ambulance, what's the town or suburb of the emergency?
Her name is Dawn. Behind her left knee, she's had a sore there that's broken down really badly.
A nurse calls from an aged care facility on behalf of an 85-year-old patient.
Has this patient been seen by an RN or doctor?
Yeah. Now, we've given her morphine at the moment, so she's resting comfortably.
Oh, good.
So she just needs to be reviewed up at the hospital.
Yeah, definitely. No worries at all. That's organised to get out.
In car 5122, Shane and Shelley will be bringing the patient to hospital.
We've got a lady, she's a 85-year-old female at a nursing home. This lady's got a bit of a sore knee, apparently, to the point where she's actually been given some pain relief by the nursing home.
My favourite part of this job is like meeting the elderly, but probably also the hardest part of the job as well.
Nursing home jobs?
That's always of concern, isn't it?
Yeah. I know.
I remember after school, when I was in high school, I'd hang out at the shops until Mum could pick me up to take me home. And I would find myself talking to the oldies in the shopping centre. I just thought they were so sweet. Maybe I'm just an old soul deep down, but I've just always really loved the elderly and have so much respect for them.
Hello.
Dawn, I have a teddy for you.
Dawn suffers from late-stage dementia, has had multiple strokes and is non-verbal.
What's her history?
Dysphagia, incontinence, stroke, epilepsy, aspiration pneumonia, diabetes, sleep apnea, acute kidney injury.
When we're treating elderly patients, we need to be aware that they're very, very susceptible to infections. Elderly patients have a significantly lowered immune system. Their organ functions aren't working as well, and they can be very susceptible to sepsis. What looks like a minor wound and do no harm to a younger person can be absolutely life-threatening to an elderly patient.
Sorry, Dawn.
Sorry, Dawn.
Oh, you're okay. You're all right. Just got to check your sugars. I think I'm going to cry. 8.7.
Sorry, sweetheart. I'm sorry. You're going to be okay, all right?
Quite often people that are non-verbal, they can't tell you where the pain is, they can't tell you where it hurts, they can't tell you what they're feeling. Sometimes that can be very difficult, but you just have to work at it to try and make this patient more comfortable.
Oh, Shane. You big old teddy bear, you, Shane. All she wants is to hold someone's hand.
Sometimes when you're working with the elderly, it can be when they're towards the end of their lives. And sometimes it's a real privilege to be part of that journey that they are undergoing. She just patted my knee for me.
Oh.
Are you going to break my heart, darling? There you go. And the opportunity to provide a little bit of comfort can be very rewarding. How about I hold onto your hand and you let me put this on you? I think it'll make you feel a little bit better. There we go. These people, they really do need our assistance and our help. To be able to ease their pain, ease their suffering, give them some dignity. All she wants is a little bit of human touch. You can see it in her eyes.
Oh.
Poor thing.
You ready? Oh. Hello, lovely. Hello.
Oh my God, that's so good.
That pleases me. For someone who hasn't got a sweet tooth as such.
The taste is nice, the texture's like gooey or pasty in the middle. And...
Yeah. Well, that is what a traditional brownie is. Like almost fudgy. Jan doesn't like those fudgy brownies. She prefers a cakey sort of brownie.
Well, you tell Jan.
I'd tell her she doesn't know what she's talking about.
Yeah.
It's Friday night. Paramedic team Andrew and Archie are almost at the end of their shift.
You know what my daughter's been doing? I caught her yesterday when I went home, scrubbing the wash basin with my toothbrush. So what are you doing? It's like, oh, whoops, I guess I'm not supposed to be doing that. I was like, what? Oh, how long have you been doing this for?
It could be worse.
I don't, yeah.
She could have been scrubbing the toilet bowl.
Who says she hasn't?
I think she has. And I think she's been doing it for a while.
Ah, so I've been talking so much crap.
So I haven't worked with Archie for that long, but the first time that we jumped into the ambulance, I thought, God, this guy's got a killer smile. By the halfway through our first shift, I think we're having a pretty good conversation about daughters and that sort of thing, and about how big a shotgun we're going to have to keep the boys away once they get old enough. I think he's someone that I'm going to, have a good time working with.
Across Brisbane, more than 250 ambulance resources are dealing with a surge in demand. At the operations centre, they're experiencing a record volume of calls.
Ambulance, what's the town on Okay, tell me exactly what happened.
My daughter's like somebody's cough and there's like blood everywhere. Mate has got a top bit of his thumb.
He's amputated the end of his thumb.
Half amputated.
There is an older gentleman.
Yeah.
He's lying in the middle of the road. Someone's knocked him off his bike.
Is he completely alert?
No.
I was making myself some lunch. Next thing I knew, I woke up on the floor and I've got a knife stabbed in my stomach.
Okay.
I must say that probably in the last 26 years of service, I probably haven't seen it quite this busy, but we're doing everything that we possibly can to make sure that we're attending patients in a timely manner.
Put your other hand on top of that hand. Okay, pump the chest hard and fast, at least twice per second and 5 centimetres deep, okay?
Okay.
All right, so 1, 2, 3, 4. 1, 2, 3, 4.
With multiple calls per minute, it's all hands on deck, with senior staff pitching in to help.
QS Bravo 501161 and Bravo 501163, just swapping your cases around.
When we are busy, which today is one of those days we can come out and assist on the floor. So get to maintain my own skills and do a little bit of everything. Working together. Teamwork makes the dream work.
Ambulance, what's the town or suburb of the emergency?
It's Mengi. I'm sorry, I'm not to breathe at the moment.
Pardon?
I'm struggling to breathe at the moment.
Okay, take a breath for me.
I've eaten seafood and I'm allergic. I don't have it.
Okay. So I need you to stay nice and calm. I've organised some help for you, okay? Stay on the line.
We are going to a 34-year-old male that has eaten seafood. And he's allergic to seafood.
Why did he eat seafood?
Because he got takeout and did not realise there was seafood in the package. He's now breaking out in hives.
QAS attend more than 10,000 allergic reaction incidents every year. Australia has some of the highest rates in the world, with 20 anaphylaxis deaths a year.
My throat's starting to get really tight.
I want you to focus on some nice breaths for me, okay? Focus on those nice breaths for me, darling. You're doing really, really well.
First thing that comes into my head when I hear about anaphylaxis is how potentially very unwell they are. I think, how is the patient going to look? Is the patient going to be extremely short of breath? Are they going to be pale and sweaty? They may need some support with some of the medications that we can provide.
41, there you go, 39.
They can rapidly deteriorate, worst case scenario, into cardiac arrest.
Hello, ambulance service. Hello, ambulance service. My name's Arky, this is Andrew.
So my partner's away tonight. I literally just ordered food and I started to eat and then I started to get the clammy feeling. My throat's a bit restrictive.
Okay.
In Ningi, Andrew and Arky are attending a patient having a severe allergic reaction.
What's the worst that's happened in terms of your allergic reaction?
Anaphylaxis.
Yeah. Yeah,
And
so
I've had to have EpiPens before.
I'm inclined to give you like the EpiPen stuff, but we'd have to go to the hospital. Sure. The EpiPen stuff is adrenaline.
Sure.
One of the effects of adrenaline is you might get the shakes, your heart rate might go up a bit. But what I would like to do is get you on the stretcher and stuff like that before I give it to you.
Sure.
So that if anything were to happen, we can sort of be able to manage it a bit better, and that way we don't have to jump around too much with the little one.
We'll help you get the bag together and like that.
Yeah.
Do you want me to hold it? I'm happy to have a...
Don't mind.
I'm happy to have a couple.
You beat me by half a second.
Oh, you snooze, you lose.
I really feel like I need to vomit at the moment.
Yeah. If you need to, give me the bottle.
With anaphylaxis, we can turn up and the patient may actually present reasonably well. But anaphylaxis can be a little bit tricky because they can bounce back or rebound for up to 3 days later. So it's always important that they get transported to hospital to watch them and observe them and keep an eye on their vital signs.
It's all a big fuss, isn't it?
How well is she handling a stranger?
Oh, yeah. She's
got matching haircuts.
Matching haircuts, that's what it is.
All right, shall we?
371, go ahead.
Yeah, if you want to take that so you can... I'll come back in and get the other stuff.
Climb in. Yeah, sit there, throw your legs up around, mate. Yeah.
Yeah, let's get you out of the breeze.
Yeah. Feel nauseous, Jeff?
I don't feel nauseous now, that's the thing. Like, I just feel like I'm severely anxious at the moment because I don't want to have an adrenaline shot.
All right, okay. You don't want to have the adrenaline shot?
Probably, like, I prefer just to get monitored like I did last time.
I think so too now, okay? We'll head up to the hospital. Until I really need to give you the adrenaline, I won't, all right?
Yep.
I'll sit you straight. That way you can hang on to her. Are you all right? Yes, you can.
Yeah,
hello.
you get your...
Look at how strong your head is. You're a strong baby. How old is Fiona?
She's 6 months in like 2 or 3 days. So...
I don't think my wife will trust me as much as yours trusts you. That's good.
That's probably because you're incapable. But compassionate.
She's so cute, man. My 3-year-old, every time she hears a siren, she says, "It's Dada's work. It's Dada's work." I was told a story when she was at daycare one day. Her teachers didn't know that I was a paramedic, and she heard a siren and she said, "Oh, it's Dada's work. It's Dada's work." When I went to pick her up, they said, "Oh, are you? Do you work in the emergency service?" I said, "Yes, I'm a paramedic." And I think a week later, they asked if I could come and do a show and tell. So, yeah, my 3-year-old, she's very proud of her Dada's work.
Back at the operations centre.
I just want to go home and sleep. It's been such a big day. Yeah.
We'll be there as soon as we can. Okay. All right, thank you. Bye.
One of the busiest days on record is coming to an end.
That's my last call of the shift. I've been with the ambulance service for over 10 years. See you guys. Have nice days off, eh? See ya. I think it's an absolute privilege to be able to be part of someone's life in the most critical time of their life. Even though it's horrible for them, you're helping. No matter what you do, you're always helping.
Next time...
There's a street accident. Someone's been hit by a car.
A collision in the city.
Back of your neck here, any pain?
Paramedics lend a helping hand.
How can we help you today?
And a baby on the way.
But don't worry, it won't be the first baby that's born in an ambulance.